Good afternoon or good evening, everybody. Thank you for joining us today. This is our monthly H&D webinar that we've been doing since the beginning of the pandemic. And we're so happy to have everybody come back today for another installment. We've been doing it for quite a while. We took a couple months off in the summer. And now we're back with one of our most popular presenters. Justin is going to be with us today, speaking about balance and exercise and the importance of that to avoid the risk of falling, and how the pandemic has played a major role in the risk of falling. So he's going to present to everybody some data that he found. And also, we're going to poll everybody today as we go along to get your feedback as well. So just a little bit of housekeeping here. This is going to be recorded. If you want to stop your video at any point, you can just do that. Otherwise, you can feel free to participate. There'll be some exercises towards the latter half of today that we would love to see you doing with us. So after today, in a couple of days, you will get a recording of this. So don't feel free that you have to take notes or anything. If you have any questions throughout, we'll pause throughout the webinar today and answer your questions. You can submit them to me through the chat. And that's about it. So allow me to introduce our presenter today, Justin, who's our director of Vestibular Rehab at H&D Physical Therapy at Midtown. He's a licensed physical therapist with a bachelor's and master's degree in health sciences from Boston University. He's worked at Northwell Health as lead PT at inpatient and outpatient brain injury rehab programs. As I said, he's currently the director of our Vestibular Rehab program, and he works with people with balance and dizziness and neurological conditions. So he is passionate about helping people with mobility deficits achieve greater independence, reduce their risk for falls, and improve their quality of life. So I hope you guys are ready for what proves to be an extremely pertinent topic today. So without further ado, take it away, Justin. Where are you? All right, let me spotlight you.
Thank you. So I'm Justin Ettinger. I am the director of Vestibular Rehab at H&D Physical Therapy. So H&D Physical Therapy has 3 locations. I'm in our Midtown office. We're at 2nd Avenue by 43rd Street. There we have another location on the Upper East Side at 88th Street by Park Avenue. We have a hand therapy clinic on 34th Street by 2nd Avenue. So I specialize working with people with vestibular and balance rehabilitation. So that means I help people that are dealing with vertigo, dizziness, balance issues, mobility issues, falling, fear of falling. So that's pretty much all I do. I also co-lead a balance and exercise class. It's online right now. It's on Fridays at 3 p.m. on via Zoom. It's every Friday. I'll post a link in the chat if anyone is interested. It's just a link, it's kind of long link, but it's something you can click to sign up via our website, or you can call the office or go to our website if you want to sign up. So, and I'll also right now just include my email address. So if anyone has any questions or comments or anything they want to directly contact me, there's my email. So today we're going to kind of go over this online poll, which talks about physical activity and falls that may be related to kind of pandemic related activity restrictions, right? And we'll talk briefly about fall risk and then go right into some balance exercises. That's the main event. So the University of Michigan, they administered an online survey back in January 2021 to a randomly selected group of older adults. There was 2,023 older adult survey between 50 and 80. The survey questions were related to physical functioning and falls during the COVID-19 pandemic. So we're going to briefly go through a few of their survey questions together. So I'll give you a chance to respond. No one will see what your answer is. You don't have to answer. The poll will come up, and I'll read through it. We'll take a minute or two to answer them, and then we'll go over the responses and then see what the actual survey says. So we're going to answer 4 questions. Number 1, how has the amount of time you spend on your feet or walking on a typical day changed since March 2020, if at all? So the answers would be more time, less time, or no change. The second question, how has the amount of moderate or more vigorous activity that you do changed since March 2020, if at all? So I'll just read them and you can answer them at your leisure. So it's more physically active now, less physically active now, or no change. The third question is, since March 2020, how many times have you fallen? So it would be 0 times, 1 time, 2 to 3 times, or 4 or more times. And then lastly, did you delay or not get any medical care that you felt you needed after your falls? And you would select all that you that apply to you. So it's yes, delayed care, yes, did not get care, or no. So I'm gonna pause here for a minute and let you go through those.
Looks good, Justin. It's people are filling out the polls. And it's working. So congratulations.
Yes. How many physical therapists does it take to put a poll up on Zoom? It took 2, by the way. They don't teach us this in school. Another 20 seconds here. End the poll in 5, 4, 3, 2, and 1. All right, so then we're going to share the results. So you see this, Aaron? The result?
Yes,
all right.
I could see it.
So first question, how has the amount of time you spend on your feet or walking on a typical day changed since March 2020, if at all? So 43% of us say that that we're spending less time on our feet since the pandemic started. Third of us say there's no change, and about a quarter more time. Maybe we have more time on our hands, so more time to move around. Well, that's great. But clearly it's not the majority. Second question, how has the amount of moderate or more vigorous activity that you do changed since March 2020, if at all? So almost half of us are less physically active now. And that has big implications, and we'll talk more about that later. About 29% no change, and then a quarter of us are more physically active now. Maybe the same 24% from the first question might be, so whatever you're doing, keep on doing. The pandemic is treating you well. So question number 3, since March 2020, how many times have you fallen? So now this is big. So 48%, 0 times, 48% 1 time, so about half and half. And we have one response with 2 to 3 times, and no one responded 4 or more times. And then lastly, did you delay or not get any medical care that you felt you needed after your falls? And select all that apply. So most people, which is great, did not delay the medical care. 14% did not get care, and 1 in 10 delayed the care. So, interesting results. I'm going to stop sharing. And it's to get the poll off your screen now, you'd have to like X on the top right of the poll. You can just exit out. No more polls. So this is what thank you for participating, everyone. This is what I'm going to share my screen real quick. So this is what the actual survey revealed, right? That as expected, the COVID-19 pandemic may have contributed to changes in physical activity and physical functioning among older adults. Like, we were being told to stay at home, so we did, right? But periods of inactivity can really lead to negative health consequences, and that's what I've been seeing, and us at H&D Physical Therapy have been kind of seeing through with physical therapy sessions during the pandemic. I worked with a few clients that were no longer either physically or sometimes even mentally, because of fear, able to leave their homes after the stay-at-home orders back last spring. And I actually needed to go into their homes to kind of help them in the home to be able to actually get to the clinic for therapy. So just a short period of inactivity can really have negative health consequences. So one thing the study found is that more than 1/3 of older adults said they were less active since March 2020, around 35% reporting spending less time on their feet. So that was kind of similar to what y'all said. Next, that more than 1/4 of older adults said their physical condition, meaning their flexibility, their strength, their endurance, had gotten worse since March 2020, with 1/5 of the respondents saying that their mobility, meaning their ability to move around, had worsened. And that's similar to what we saw. Maybe a little more on some of our questions. And then down here, we'll talk about falls. So a quarter of older adults reported, according to the survey, reported having at least one fall from March 2020 to January 2021. And so interestingly, that of those people that said they've fallen, 60% said they had one fall, 32% 2 to 3 falls, and 8% 4 or more falls. 70% experienced an injury, which is big, and 40% of those that fell needed some kind of care after their fall. And similar to kind of what we saw, that there was some people did delay care, and that's big. So 12% delayed care and 16% never received the care that they needed, with the major being that the pandemic for not receiving the care. Either they didn't want to leave the home, or fear of going to the doctor's office or being around other people. And so yeah, let me stop sharing.
I have a question, Justin. What does the survey attribute the increased falls to? Is it just as simple as less physical activity, or is there other factors involved?
No, they can only speculate, but it's likely due to the decreased physical activity, and that's kind of what we're going to go go into for the next part of the leads right into our getting ready for our exercise portion. No questions?
I think we're good.
All right, great. So to kind of recap that, right, decreased physical activity we're seeing can lead to an increased risk for falls and injury, kind of what Aaron had asked. And we're less likely to seek care a bit, and falls often kind of contribute to a fear of falling, which can then lead us to decrease our activity even more, right? And the cycle continues, and things can worsen. So it sounds all gloom and doom, you know, we want to kind of get out of that cycle. So what can we do about it? That's what we're here for, right? We can really get on the offense for helping reducing risk for falls. And there are many proven and researched ways of reducing fall risk. Blood pressure management, getting your vision corrected. Vitamin D is, people that are low in vitamin D, there's taking vitamin D has been proven to reduce risk for falls. Early cataract surgery, medication management. There's lots of different things. Probably the biggest thing the easiest thing we have at our fingertips is exercise, right? This is where we're going to focus the rest of the session. So exercise has very much been proven to reduce your risk for falls, and that's something we all have at our fingertips. But not all exercise is the same, and that's an important thing to note, right? The research shows that multi-component exercises are the most effective, and multi-component meaning that exercises that are focusing on your strength, your endurance, your flexibility, and probably most importantly, your balance, right? Hitting exercises that you don't have to do. Every exercise has to hit all those components, but sometime during the week, you want to be hitting all of those components in order to really help reduce your risk for falls, right? Also physical therapy and specifically vestibular therapy, which I talked about before, being more focusing on working with people with balance and vertigo and dizziness issues. They're all often related. Those are proven ways to help reduce your risk for falls. And also, there's been a lot of research with Tai Chi and how it's just the research article just supports Tai Chi with being very effective at reducing your risk of falls. So Tai Chi is just comes from an ancient martial art that has you slowly and deliberately going into different positions where you're shifting your weight, you're turning. There's a lot of repetition, and it is fantastic exercise for your balance and reducing risk for falls. I know it's hard right now or difficult right now to participate in in-person Tai Chi classes, but when things become back in the world, when it's I highly recommend. But today, so now we're gonna go into some balance exercise. So you do not have to participate at all, but I highly encourage you to. So the only equipment you'll need is a chair. So the chair, a sturdy chair is something that you can sit down if you need to, or you can touch the back for your balance when you need. You also should either be wearing shoes, so something supportive, not sandals or slippers, or bare feet. It's preferred not to be in socks, right? You can slip easily on the surfaces of your floor. You want to kind of make sure you have a little bit of a space around you that you can move around in without tripping. So kind of clear out any items that might be in the way. and everyone is at a different level, so it can be difficult. So we have 41 participants. It can be difficult to choose exercises that everyone is going to be, that's the right exercise for. So some things might be too easy, some things might be difficult, some things you might not be able to do, which is fine. I'm going to go through maybe some ways to modify things. If something just doesn't feel right, that it's painful or you feel like you might fall, don't do it. The goal of today is to remain vertical. And always feel free to touch the chair. Feel free to ask questions. At the end, we'll have plenty of time for discussion and questions. You can always save any questions and then as well. And yeah, so I'm just going to shift my camera so you can see me because I'm going to perform them too. We're going to start standing next to your chair. We're going to stand with your feet together. So by keeping our feet together, we're narrowing our base of support. Right? So that's going to automatically increase the challenge. So feet together, try to keep good posture. Right? Your stomach muscles should be engaged. Standing straight. If it's kind of, I feel like this is a good position to check in with your balance. So if it feels like a good thing to do, we can try closing our eyes here. Right? If closing your eyes does not feel like a good thing, then don't do it. Well, feel free to open them when you need to. We're just going to feel the difference between the eyes open and eyes closed. All right, let's open our eyes. All right, so have you stop looking at my feet for a moment. To keep our balance, our brain has to figure out where we are. And so it takes information from our eyes, from our feet have sensors on them, and also our inner ear. All those information senses where we are, tells your brain, and then your brain tells the rest of the body what to do. So when we do things like closing the eyes, which we're going to try it again, but this time, if it feels like you can, with your eyes, feet together, eyes closed, try to cross your arms and see if that feels any different. So when we close our eyes, now our brain has to work a little harder by taking more information from your other senses to try to stay balanced. You might notice with the arms crossed that it's more challenging. For me it is, but some people feel more grounded. All right, let's open our eyes, bring your arms at your side and separate your feet. So we're going to get into our second position. So we'll bring our feet back together, but slide your right foot partially forward. Right? So the further you bring the right foot forward, or the top or the front foot forward, the more challenging of the exercise it's going to be. So the ultimate position, the ultimate challenge would be to put one foot directly in front of the other. And if that's where you're at, that's a good place to be, right? If that doesn't work, which for a lot of us it doesn't, you can bring the foot back, right? So the more you bring it back, generally the more doable it is, the less challenging it is, right? So we're going to find a position that's maybe slightly discombobulated, right? So for balance exercises to be effective, you want to be a little bit off balance, right? And that's not a bad thing. By being off balance, we're sending a message to the brain to actually make a correction. If you're not off balance when you're performing balance exercises, then it's probably not helping your balance so much. So we're going to find the position that feels like it's good for you, right? And then in this position, look straight ahead and just feel where your feet are. see if try to even your weight. So try not to be too far onto the right leg or too far onto the back leg. See if you can kind of be in the middle with equal weight between the front and back leg. All right. And then next, in this, I'm going to raise my camera so you can see me, but keep your feet there or adjust them if you need. So with the right foot partially forward, with good posture, let's try to look up and down. So if this bothers your neck, if you have neck issues, but don't do it. Or you can just use your eyes. If you get very dizzy, that's not good. A little dizziness with this stuff isn't a bad thing. Up and down, you can kind of see here how just turning your head impacts your balance. We'll look straight ahead. And we'll just settle here a moment, look straight ahead. Feel see what the feet are doing. So you want to keep, if you notice that you're shifting too far back or too far forward, try to get your weight equal again between the front leg and back leg. And now let's start to turn your head right and left. The quicker you go is going to be more challenging. So that's one way to make it more challenging. Shouldn't be giving you any pain, so if it's painful, don't turn your head as much. If you're getting too dizzy, go slower or stop turning your head. And you can always adjust your feet, right, to the position that feels just a little imbalancing. All right, let's look straight ahead, and we'll try to get our balance here. When we turn our heads while we're balancing, our inner ear is telling our brain where we are, right? So this is what we consider more of a vestibular exercise, where it's training your vestibular system, which is important for your balance. I'm going to point the camera down so you can keep your feet in the same position or bring that right foot back a little bit, because we're going to try closing our eyes. And this is challenging. So if you feel like this isn't a good thing to do, don't do it or touch the chair. But if you feel like you can, we can try closing our eyes. And whenever you're losing your balance, just open your eyes, touch the chair, and return to the position. See if we can go 10 more seconds. All right, let's open our eyes and separate your feet. And then you can't just do one leg. So let's bring your feet back together. I'm just turning so you can see my feet better. And we're going to slide your left foot forward. Right? Again, the further you go forward, the more of a challenge it is. Right? The more you go back, the less challenging. So you want to you can grade the exercise. It's as you see fit. So choose your own adventure. I want it to be helpful and challenging for you, but also want you to feel safe. Doing things with your eyes closed can be a little disconcerting. So whatever you need to do to feel safe. So again, trying to look straight ahead, even out the pressure between the back leg and the front leg, right? You want to kind of be in the middle. Any of these kind of standing exercises, you don't want to keep the knees totally locked. You also don't want them to be too bent. Just a slight bend is generally what you want. And so now we're looking straight ahead. And I'm just going to stay right there, but I'm going to move my camera so you can see me. Whoops. I'm going to turn our heads up and down like before. You might notice that with one foot forward as compared to when you had the other foot forward, that one side is more challenging, and that's completely normal. We all have a dominant, like we have a dominant hand, we also have a dominant leg. This also can be related to any kind of strength issues you might be having, or flexibility. Sometimes weaknesses from the inner ear could cause changes in one side, or neurological issues, so that's normal. All right, let's look straight ahead. And I feel where your feet are again, so making sure that they're even and that you're somewhere in the center. Give your brain a little break for a moment after the head turns. And then we'll slowly, or more quickly if you can, turn our heads right and left. And then we'll look straight ahead. Regroup. And I'll let your another brain rest. And then just like before, we're going to try closing our eyes. If you feel like you need to bring your foot back a little bit to do it, or you need to touch the chair, or not do it at all, by all means. All right, eyes closed. Try 10 more seconds, if you can. All right, we'll stop there. Let's open your eyes, separate your feet. I'll pause here a second. So with balance exercises, if you are losing your balance, it's not a bad thing. You don't want to be falling over on the ground, right? That's right. So balance exercises should be, in order to be the most effective, you need to be losing your balance a bit. You shouldn't be able to read the paper while you do it, but it shouldn't be throwing on the floor, right? Somewhere in the middle is generally what you want. And this, I saw an article that said that if you're losing your balance around 30% of the time, meaning that you're coming out of the position, or you have to, let's say you're closing your eyes and you have to open your eyes, that's actually the best, your best bet to help improvements. If you're able to do positions without difficulty or without losing your balance, you might be maintaining your balance, but you likely aren't going to be driving improvements. So it sometimes can be frustrating with some of these exercises to feel like you're not doing it right because you're losing your balance, but that's actually not a bad thing. It's just, it takes some time to kind of get used to that, to wrap your head around that.
Justin, what do you recommend for footwear for some patients that are having some balance or vestibular issues? Are there particular shoes or sandals or insoles that you recommend?
You know, it seems to be not a one size fits all kind of thing. It depends on what's going on, why the imbalance is happening. That some people require more of a supportive shoe, maybe because of weaknesses in the ankle. Or some people might require a thinner shoe or an insole that provides feedback. We're working with some insoles that actually provide tactile feedback, which here at H&D, that for people maybe that have sensory issues on the feet or are not able to kind of, maybe they're, because sensation, our ability to feel the ground is important. So for some people, it could be a lightweight shoe with a thin sole that you need. Some people need something thicker and more supportive.
Definitely. I can throw the link up later at the end for people that are interested. Yeah.
We have a question. So I have flat feet and notice that balance exercises are easier if I'm wearing my shoes and orthotics. Is it better to do these exercises with or without shoes? It's a great question. I generally recommend doing any kind of standing still exercises that you might be doing at home to vary what you're doing with to wearing shoes, because we wear shoes when we walk around outside. So usually, I hope. So I think it's great to be able to do these in what we actually wear, but also there's benefit in doing these exercises barefoot, because you're getting your sensors of your feet are going to get more feedback, and the muscles of your feet will have to work harder. You know, it's hard when you know, if you're having trouble with flat feet, it can be more challenging. As I would say, if it's not painful, I think it's a good idea to still practice both ways. Some people just can't do it without footwear, and that's fine. Yeah.
There was another question. Did you see the other one that came in?
Oh,
right
where are
before?
your eyes positioned when your head gets up and down, right and left?
Mhm.
For this exercise, I was I'm sorry, I didn't mention it. I was bringing my eyes to where my head was turning. There are other kinds of exercises where you can focus on a target while you're turning your head. So if I'm focusing forward as I'm turning my head up and down. But the one I was doing, I was just turning my head, kind of like if you were outside and you were looking around and you were looking for something. Any more questions, comments before we move on? All right. So I'm gonna get right back at it. So next to the chair again, we're gonna stand with our feet a little bit wider than hip width apart, maybe something like this, right? And this exercise is gonna be focusing on picking up one leg. But as we're picking up the leg, we're emphasizing shifting over to one side. So we're gonna all shift over to the left leg and pick up the right leg, and then put the foot back down. So if you need to touch the chair the whole time, that is totally fine. But another thing to think about is your posture, right? So shoulders back, stomach muscles in, and you can't see my upper body, but I'm trying to stand up straight. And we're gonna shift to the left and pick up your right leg, and then bring the foot back down, right? We're really emphasizing the shifting over to pick up the right leg. And this kind of gets us into a single leg stance. So with this one, the slower you go, the more of a challenge, right? So you can always stay there, which is not easy. If you feel like you're all over the place with this and it's okay to touch the chair a bit. For this one, I'd rather you be in good alignment with good form than to be throwing all over the place. A little imbalance is fine, is kind of what we were talking about before, but you shouldn't be, I don't want your form to be compromised or cause other problems with your back. Let's go one more. All right, so we'll do the same thing on the other side. That's a good posture. We're going to shift to the right and pick up the left leg.
Justin, question about where the upper body is. Is it straight or is it going left to right?
All right. So it's straight. So you want to avoid tipping, right? So I'm shifting to the right, picking up my left leg, putting it back down. I guess I could move back more. There you go. So you're trying to avoid tipping over with your trunk, right? So you want to keep your shoulders, everything's level. So this kind of shifting happens when we walk. This is why I love this exercise, because I really feel like it helps getting the balance better, specifically if you're having trouble picking up your feet or shuffling while you're walking. Let's go 2 more. So I'm going to tilt it down again, get closer so you can hear me better. But when we walk, we without thinking about it, we shift to one side to pick up your leg, and we shift to the other side to pick up your other leg. We normally don't need to think about that, right? But sometimes with imbalance with walking, these kind of things don't come natural. We have to bring our attention to it, and this is a great exercise to help with that. So we're going to now alternate now. So this is going to more mirror what happens when we walk. So feet a bit apart. We're going to shift to the right, pick up the left, and then shift to the left, pick up the right. The upper body is straight again. Shift and lift. If going this slow doesn't work for you, you can go a little quicker. Generally, that'll be better on your balance or easier. It's something to think about when you're walking. The next time you're going walking, feeling how big are your steps? Are you dragging your feet? You know, sometimes one of the reasons for not picking up our feet so much when we walk is that we're not comfortable shifting onto the balancing leg. All right, the shift and lift. So I'm going to go into one more balance exercise for now. One of my favorites, the modification of the tree pose for yoga pose. So it kind of gets us into a modified single leg stance. So I'll demonstrate that. I'll show you my lower body first. You can definitely be next to the chair for this, right? Or touching the chair the whole time. We're gonna keep the right foot is gonna be the standing leg, right? So the right foot's gonna be grounded. We're gonna bring up your left heel and turn it. See if you can turn it to rest on your lower leg. My toes are still on the floor of my left foot, right? So there's still contact. This might not work for everyone. So if this doesn't work, you can always keep your feet totally on the floor, right? But we're gonna try, like, if you can do it, we'll try it. So my toes are on the floor, and this is gonna be a easier version. We're gonna do a more challenging one after. Right? So this is gonna be the foot position, and so I'm gonna keep your feet here. I'm gonna raise the camera so you can see the rest of me. I'm in that same position. Right. Good posture, strong through the core, and we'll see if you can let go of the chair and maybe bring your hands to heart center, right? Or one hand, right? You need to touch the chair, totally fine. Good posture. You want to kind of feel that right foot, feel how it's grabbing the floor. Since this is a tree pose, imagine there's roots growing from your feet. Right? The toes are contacting the floor, the heels on the floor, the ball of the foot. And if you feel like you can, let's bring the branches of your tree up. Strong through the core, right? So keep those stomach muscles. It's probably helpful to look straight ahead with this. So pick a point. Looking good. And we'll bring the hands back to heart center. Arms at your side. And let's bring the foot back down. So that right leg did a lot of work just now. You might feel it, so I'm gonna shake it out. And we'll try the same thing with the other foot, right? So now the left foot is gonna be the grounded one. Right? We're gonna bring the right foot, turn it out to rest the heel of the right foot onto the lower part of the left leg. You know, make sure your left foot is grounded, your toes, your heel, your ball of your foot is grounded on the floor. I'm just gonna raise the camera so you can see me. Okay, it's a good posture. If you feel like you can, we're gonna let go and try to bring your hands to heart center. You might feel one foot is more difficult than the other, totally normal. We'll see if we can bring the branches of our tree up. I'm not a yoga instructor, so this is not the true tree pose. So don't hold me to the positions. Might notice your tree is swaying in the breeze. That's totally fine. Bring your hands back to heart center, back to your side, and then foot on the floor. And speaking of trees, which I cannot believe I forgot to lead with this when we started the webinar. This week is National Falls Prevention Awareness Week, which is why we're having this webinar. So that it happens on the first week of fall every year. Get it? Falls. So sorry about that. So we can make that a little more challenging if you feel like you want to. And we'll quickly go into one more repetition for each leg with increasing the challenge. So go back to the left leg being the standing leg. Well, if you feel like the first position was hard enough, keep it there. But we can make it a little more challenging by sliding your right foot up your left leg a little bit. So now that my right toes are not on the floor, make sure you're below the knee, right? You don't want to be at the knee. That's bad for your knee. It can destabilize you. So you're below the knee. And good luck, everyone, if you're doing this. So you're going to stay in that position. We won't hold it as long. We'll get the hands to heart center if you can, or one hand. One hand is fine. We want everyone vertical. Hands up. The tree. Hands back to heart center. Arms down. Foot down. All right. We'll try the other one. The right foot is the grounded one. The left foot is going to slide up below the knee, somewhere below the knee and above the ankle. Good posture. Going to stay in that position. Good posture, hands to heart center if you can. Arms up. Everyone's trees look great. Heart center. And then hands back at your side. Feet on the floor. Nice job, everyone. So those were just 4 samples of some balance exercises. Those are those ones I really enjoy. They're easy to replicate at home. You don't need any equipment. So yeah, I co-lead a balance and exercise class in this format on Zoom every Friday from 3 to 4. And we do a lot of these exercises. If anyone's interested, more than happy to have you. But that concludes the exercise portion. I guess we'll open up to any more questions, comments, concerns.
So yeah, there was a question that came through about the exercises that you recommend for pivoting while walking. I mean, do some of these that you went through today help with turning and pivoting?
Not maybe the only exercise that might have been specific for that would be the turning of the head, because sometimes turning and pivoting, some of the issue is the actual head turn, or it could be the incorporating the body as well. So for balance exercises to be effective for what you're having difficulty with, you want to work on the things you're having difficulty with. So
Right.
Those are the times when going to a vestibular or balance physical therapist would be the most effective to help you find the best exercises to incorporate into your program.
So where can people sign up for your class, Justin, if they want to do that? Can they do that online?
You can go on our website to do what you can, but I have a link that it's an ugly link, but it'll take you to where you do it. I'll put it in the chat. So that's how you do it. You would before the first class there's some enrollment form you need to fill out, and liability things. I think there was another question on the chat.
Yeah, it was for people that feel like their ankles are weak. Are there specific strengthening exercises they can do to address that?
There are. I just actually just doing my favorite exercises for ankles are actually doing some of these balance exercises, because your ankles muscles have to work very hard to, if we're doing them correctly, they have to work. And but it sounds like if you're having weak ankles and it's contributing to maybe balance issues or falling, I would recommend seeing a physical therapist to figure out exactly which muscles are the weak ones, and then that'll lead us to figure out which are the best exercises that you might want to incorporate, and not only just these standing balance exercises, but maybe some other ones that target the specific muscle groups. What do you think, Aaron?
Yeah, I'm not a huge fan. I was just putting up our phone number for the Upper East Side or I'm sorry, for Midtown location, because there were some potential problems with the link. So you can always call our Midtown office to hook up with Justin's class.
The link, if you click it, you got to click one of them. It comes to you have to click one of the calendars where it says either telehealth or Midtown. If you click any of those, and it'll take you to a calendar, and then you can choose the dates, and then you can sign up from there. A little complicated. We're working on it.
Yeah, you just feel free to call any one of our offices, and they'll help you get into the class. But to answer your question about the specific ankle strengthening exercises, unless someone has like a major deficit, right, in some of their muscles or ligaments or tendons down there, then I'm more of a fan of like weight bearing exercises on unstable surfaces to get everything firing at once. So we didn't have time to get into that today, but a lot of the stuff that we do in the clinic involves balance pads and balance discs and Bosu balls and all these, fun toys that we use to help really challenge people's balance.
I see another question. What do you suggest if one leg is longer than the other leg? One of mine is 5/8 of an inch longer. That's a significant difference of a leg length, right? And that will definitely impact your balance, right? And your walking. There things you can do stretching wise. There are things you can do there. Sometimes some people have success with putting in a lift or into the shorter leg into the shoe, or so if it's significant, then a shoemaker can actually construct the sole of your shoe to be larger, and that can help with balance. It can be tricky because you might have had that leg length discrepancy for a long time, so you're used to it. And so once you start to correct it, you might for some time be more off balance, which is common. So that's a big 5/8 of an inch is significant, and if you are going to play with that, you might want to see work with a physical therapist to help you with what the right exercises and what the right height of any kind of lifts you might be putting in. Any other questions, comments? I think we're getting to the top of the hour.
This was really helpful, Justin. I think that you did a great job today in demonstrating some of these exercises that look simple but aren't quite so simple. And this is a great start for people to get on their way. So thank you so much.
Of course, my pleasure. Thank you everyone for attending.
Yeah, and we hope to see you guys again soon. We'll be doing these monthly virtually for now via webinars, and then hopefully we'll be able to see you guys in person again when we do these live events in the near future. But until then, be well and stay safe, and feel free to email Justin or myself if you guys have any specific questions. And we look forward to seeing you all soon.
Thanks, everyone.
Thank you, guys. Be well.